If you want to get rid of your golfer's elbow fast, then stop exercising and stretching and start working on these 3 muscles. Here's why. Take a look at these tires and tell me what's wrong with them. Yes, that's correct. It's actually cake. No, I'm kidding, obviously. The answer is one side is worn down while the other side isn't. But how did it get this way? It's because you have cars that drive around like this with their wheels angled out for whatever reason. I'm not a car guy, so I have no idea. And as you can see, when you have cars that drive around like this, you will end up having tires with more wear and tear on one side versus the other. But what does this have to do with golfer's elbow? Everything, because this is what's happening to your elbow when you have something like golfer's or even tennis elbow. Golfer's elbow, also known as medial epicondylitis, isn't created by inflammation in the elbow. It's actually created by mechanical loading of the muscles and the fascia around it, resulting in inflammation. Now, what do I mean by mechanical loading? What I mean here is that the muscles and the fascia on one side of the body, in this case the forearm flexors, is so tight that it's now pulling the elbow in that direction, resulting in more wear and tear on one side versus the other. So if this is true, then what is the traditional treatment here for treating something like golfer's elbow? If you ask your doctor, they're going to be telling you to do things like stretch your forearm flexors and strengthen your forearm extensors. But if you ask me, this is the slow way for treating something like golfer's elbow. And the reason why is because they're not targeting the one main reason why everything's actually tight, your fascia system. If we try to do the equivalent of a stretch and an exercise to fix this crooked tire, then that's like me saying I'm going to push this tire straight, hold it there, and then try to bolt it down in a new position. Well, we are actually missing one key piece here, and that is to actually loosen the previous bolts holding it in that original crooked position. And just like those original tight bolts, your fascia is what's locking up your golfer's elbow in that tight position, which is also why it may take months for you to see any results if you ignore the fascia system. But if you simply loosen that fascia, just like you would loosen the bolts prior to fixing that crooked tire, then not only would stretching those tight muscles become way easier, because they do become tight thanks to the fascia, but strengthening those other muscles like the forearm extensors will become way easier and more effective. And that is why if you want to see fast results with your golfer's elbow, then don't start with any sort of stretching or exercising and start with a myofascial release, which is actually really easy to do on your own. It's just uncomfortable, which is why most people don't do it. Now, I will be showing you how to perform these myofascial release techniques in a little bit, but first let's transition into those other muscles like the pec major and the triceps and how they can create pain that feels like golfer's elbow. Some interesting things about your fascia system is that not only does it wrap around your muscles, but it also wraps through them and wraps onto the next one, and then the next one, and the next one. These are known as your fascia lines, and it's most likely the main reason for your elbow pain stemming from your chest or your triceps. What you're looking at here is the superficial front arm line and the deep back arm line. And what these lines are showing us is how the triceps and the chest is connected to the inside elbow through the fascia system. What these lines also show us is the referral pain direction for trigger points in these muscles, meaning trigger points in the chest and the triceps can refer pain down into the inside of the elbow. I do believe that your fascia system is not only the main reason for your body feeling tight, but it's also the main reason for that random pain you get as you get older, which means you need to work on your fascia system first if you want to quickly treat your pain like your golfer's elbow. But does this mean all those exercises and stretches were wrong? No, it's not, because after you release the tight fascia, you still have to stretch out those muscles that are stuck in that shorn position thanks to the tight fascia. And not only that, if you don't strengthen those muscles like the forearm extensors after, then that tight fascia and those muscles are going to shorten back up thanks to your daily habits like golfing or being a professional jar opener. This is a 3-step process for getting rid of your pain, and it works for most types of pain. You can't just exercise the weak muscles, you can't just stretch the shortened muscles, and you can't just release the tight fascia. All 3 things are happening at the same time which is why you should address all three aspects. So with that said, let's quickly go over a simple treatment plan that you can do at home. To perform a mild fascia release, you will need something like a foam roller if you're a beginner at doing this kind of stuff. Or if you're a little more advanced and can take some pain, then you can use something like an MB5 ball or a lacrosse ball. What you're going to want to do is start off by simply rolling out the chest, the pec major here, for 30 seconds using light pressure and going at a slow pace. The idea of this is to simply warm up the muscles, but to also look for the most tender spots within the chest that are either tender or recreate the pain that you're feeling with your golfer's elbow. After the 30 seconds, go ahead and move to the most tender spots or the spot that recreates your pain and just simply hang out there trying to apply as much pressure as you can, reaching an 8 out of 10 on a pain scale here. The idea is it should be uncomfortable in order to get rid of these trigger points, but you should still be able to breathe throughout the discomfort. Breathing is the key here to releasing the muscles. If you're not breathing, the muscle's not releasing. Do this for another minute or two, or until that pain begins to go away or dissipate or change directions. Now from here, perform deep strokes by applying a little more pressure and then dragging your body across your massage tool. The more pressure you're applying, the slower you should be moving here. The idea is we're trying to move in all of the different directions, performing these slow strokes going across each one. And all this is happening over that one tender spot that we just worked on for static pressure. Again, make sure to do this technique for another 1 to 2 minutes. Now finally, stay on that same spot one more time. Reduce your pressure to about a 6 or 7, enough to kind of grab the tissues but not apply pressure. And now perform a pin and stretch by simply moving your arm through its full ranges of motion. This means flexion, extension, abduction, and internal and external rotation, and a combination of all of those movements. Do this for 1 more minute. Now remember this sequence because we're about to do the same thing but run it through the triceps now. Starting off by warming up the muscle for 30 seconds, once again looking for a tender spot. It may help a little bit for you to find that tender spot if you have the muscle stretched out or if you have it bent and trying to get a little deeper into the muscle. Again, hit it for 30 seconds looking for a tender spot that recreates your pain or is just really tender. Now from here, hang out on that tender spot and apply some static pressure for 1 minute. Now move into deep strokes by moving back and forth and side to side with slow and deep pressure here. Again, doing this for 1 minute. And now finally, perform a pin and stretch by reducing that pressure first and then taking your arm through its full range of motion by flexing and extending the elbow. One more time, do this for another minute. Now we can move into the main muscles that are most likely creating your golfer's elbow, which is going to be your forearm flexors. Now what makes this great here is we can once again run through that same exact sequence for our forearm flexors with an extra technique at the very end. First, start off by rolling out your forearm flexors for 30 seconds. You can either do this with it facing down and just rolling back and forth on your tool, or you can use your hand and use the tool on top, whichever one is comfortable for you. Once again though, look for the most tender spots as you warm it up. Next up, perform some static pressure on the most tender spot that you found within the forearm flexors. Now from here, move into deep strokes for another 1 to 2 minutes. Be a little more cautious here as you do this because there are a lot more nerves and blood vessels towards the surface of the skin versus the other areas of the body where it's a little more deeper. And now finally, go ahead and perform a pin and stretch by either flexing and extending the elbow to help stretch those little areas out by the elbow, but mostly by flexing and extending the wrist as well, mainly extending it in order to stretch out the tissues. Do this for another minute. Now let's kick this up a notch by quickly putting on some lotion or some balm on your forearm and then grabbing your gua sha tool. Start off by scraping across your forearm flexors, looking for anything that feels like sand underneath some paper. These are the gritty areas that we're going to come back to in a little bit. But for now, simply move across it back and forth for 30 seconds. Now with that said, you don't need to apply a lot of pressure here. Probably maybe a 3-4 max as you apply your pressure. The idea here is we're just trying to work on the superficial tissues above the muscle. We're not trying to get into the muscle. Now after finding a spot that feels gritty, begin working on that spot by scraping it in different directions. Think of it as a clock, and your goal here is to scrape in every direction as the numbers on that clock. Try to perform about 5 to 7 strokes in each direction. Now if you want, you can easily work on another 2 to 3 spots within your forearm in order to help loosen up that fascia. So now that you're done releasing all that tight fascia and even the trigger points in those other muscles, now is the time to go through those different forearm flexor stretches because the fascia is no longer restricting it, and now it's going to be easier to stretch out. And now finally, you can do those different exercises for your forearm extensors in order to make them stronger. Remember, if you try to do this first, then not only are you trying to strengthen the muscles going against those shortened muscles in the forearm flexors, but you're also trying to strengthen weak muscles against the tight fascia, which is again why it takes so long for you to see results if you ignore the fascia. This is why if you want to treat your golfer's elbow fast, stop exercising and stretching first and perform a myofascial release instead. Then do your stretches and exercises.